celebrate our 60th anniversary, it's my immense pleasure to welcome Professor Mumtaz Patel, who is our Royal College of Physicians President.
Oh.
Hello. Hi, Mumtaz.
Hello, lovely to be here, and thank you so much for inviting me. It's a real honor to be here as well.
You've just given us an inspiring lecture about your leadership journey. Mm-hmm. What do you think that is the main achievement that you have in your life?
Oh gosh, lots of different achievements, I think. But I think what we talked about within the presentation was very much how we overcome some of these challenges. And I think we're both similar sort of backgrounds in the sense of women in senior leadership positions, being from a different ethnic minority background. And sometimes it feels quite challenging to, particularly for our resident doctors or even medical students, to aspire to such senior roles. But I think what we were trying to demonstrate is that a lot of these challenges can be overcome. They're common challenges that others may be faced with as well, and always aim high, and these things are possible. And it's been a great journey to be able to share both my clinical research as well as the leadership journey.
Yeah, absolutely. So your lecture really, had several takeaway messages, mm-hmm. and one is more like never ever give up. Persistence is also important, and try to balance your sort of imposter syndrome with arrogance in a way, which can go both ways.
Absolutely.
So thank you for all your takeaway messages, and I could see during the lecture there was many people there very inspired and also intrigued to think about how to become leaders. Mm-hmm. Mm-hmm. So. And obviously you had really great support from your family, mm-hmm. Yes, and I think currently as well you had that strong message as well. So is there anything else that you want to tell us about that, or maybe some other role models?
Yes, no, absolutely. So I think it's really important to have people who support you around you, and I think I was very grateful for my family, friends, and that kind of supportive network around me. But also allyship and mentors. I think I was very blessed to have lots of really good mentors, from medical student to early, kind of junior doctor, resident doctor kind of level as well, and male and female, because a lot of what I talked about was overcoming challenges as a woman, work-life balance and children and things. But I think for me, it's just making sure that you've got that supportive network around you. And talking about imposter syndrome, I think that is very much real, and how I tried to sort of talk about it was reframing it to say it's very normal, and how we can shape that to use it to your advantage, because it just makes you grow and makes you better when you think about how you can develop yourself as well.
Yeah, fantastic. So I just want to ask you about nuclear medicine. Yes. Clearly, as a Royal College of Physicians President, you are really supportive of us, and thank you for that. So how do you see our specialty nowadays when compared to maybe when you started your journey?
Yeah, I mean, there's so much change, goodness me. Nuclear medicine now, in its 60th anniversary, 30 years this year is when I qualified, and as a house officer here in Manchester, I remember the nuclear medicine department, it was tiny. The number of consultants and resident doctors wanting to do it was quite small, but it's such an exciting specialty, and even just the keynote lecture today, I learned so much as well. And I know in nephrology renal, which is what I do, it's just growing as both a specialty, but also its relevance and what it can help support all clinicians, really. So I think it's a really exciting time to join in a growing sort of field, which is definitely worth exploring.
Thank you so much. I think we should have this message for all our younger generations, particularly our medical students.
Yes.
Your talk, I almost think should be shared with all young people.
Yes.
Because it's so inspiring, and it's almost like if you have an aim in your life, you just need to go ahead and take all opportunities that are given, particularly if they are good ones. Yes, Sometimes it's quite difficult to judge where to go, is it?
Exactly, and I think that's why sense checking is important, because I think, advice is good, but sometimes, particularly as you go higher up, you'll sometimes worry about, is that the right thing for me? So sense checking it with colleagues, trusted colleagues, but also with friends and family is important, certainly as well. But having that kind of drive and determination, I think, is really key, and having a goal in mind. And I think certainly I didn't think, my goal was to become president. My goal was to become a doctor, then become, kind of a resident doctor, then a consultant. And you build your goals, and as you achieve, you feel more confident to achieve more.
But it's education and then really hard work that matters at the end.
The education, the experience, and then the exposure and the opportunities that you're given. So always grab those opportunities with both hands. And that degree of also self-reflection is important as well. Is this right for me? How can I make myself grow? Taking the feedback on board and just keep going and growing along the way.
Yeah. What's a fantastic message for all of us while we celebrate our anniversary, 60 years this year.
Fantastic.
And I know Royal College of Physicians is the oldest college in the UK. It's 507 years old. Mm-hmm. And so many physicians, like 40,000,
yes? That's right, yes.
So, and we are proud to be part of the college.
Yes,
Thank you.
We're proud for you to be with us. Thank you.
Thank you.